I'm often asked the fundamental question, what makes a good facelift? There's a significant difference between a good facelift and a poor quality facelift. Poor facelift surgery with its mask of visible distortions and changes alerts us to falsity, however small these changes may be. These changes usually occur following traditional facelift surgery because it relies upon skin tension to create a superficial and relatively short-lived appearance of rejuvenation. Essentially, with aging, people tend to become similar looking. Unfortunately, some facelift techniques do the same. Quality facial surgery does not impose any change in natural appearance, nor does it leave any visible traces of surgery. Let me tell you how I achieve this for my patients. Aging of the face tends to occur either in the mid-cheek, which is this triangular area below the lower lid, or in the lower face in front of the premasseter space, which involves the lower nasolabial fold, corner of the mouth, labiomandibular fold, jowl, jawline, and upper neck. What I want to inform you of is the major advance in lower facial surgery. Using our recent understanding of the anatomy here, it is now possible to naturally tighten across the lower face without any bruising of the cheek and jawline. There are several key areas. The first is the nasolabial fold. That's the fold extending from the side of the nose down past the lips. Plastic surgeons have been successful in improvement of the contour of this fold with the advanced use of the SMAS, that's the internal support technique. Now this is even easier and the results are a lot more effective operating through the premasseter space. This patient has aging changes of her lower face, as you can see from the laxity of the inner cheek, almost concealing the corner of her mouth, heaviness of the nasolabial fold, extending all the way down to a prominent jowl which is obscuring the natural definition of her jawline, and she has laxity of the upper part of the neck. Surgical correction has achieved a generalized retoning of the lower face through the premasseter space approach, so that now she has a uniform shape across the nasolabial fold. There's an absence of the jowl, and yet there is no excessive tension along the jawline and neck. I realize that these days many people resort to simple injection techniques using fillers. However, these only give a temporary benefit as they camouflage the depth of the crease, but they do not correct the cause of the sag of the cheek that allows the fold to develop. The improvement's only short-term compared to a proper SMAS tightening, along with hydroxyapatite, that is coral, to replace any shrunken bone, particularly of the mid-cheek. Please take the time to watch the hydroxyapatite video on this website. Hydroxyapatite is a natural, coral-based bone enhancer and plays an integral part in my anti-aging facial surgery. The second area for correction is the marionette fold. This is the fold from the corner of the mouth down past the chin, and when present it reflects a major laxity of the inner cheek. It's only with the latest technique that proper correction of the marionette fold has now become possible. The third area that's been corrected is the jawline. Many patients see their jowls as the most obvious laxity along the jawline. Jawline correction takes up the accumulated laxity of the jowls. It's not possible to have a really clean, straight jawline if there's some underlying weakness in the shape of the bone, particularly the pre-jowl area. So consideration is given to correcting the jawline deficiency at the time of the facelift by correcting this deficiency with hydroxyapatite. The result of this is natural and the benefits lasting. The fourth area to consider is the neck. Some people are unfortunately born to have a heavy neck in which the neck starts just beneath the tip of the chin rather than having a properly revealed throat. This patient has premature aging changes of the anterior face and particularly the neck. You can see the heaviness of the jowl and the lack of a contouring of the neck. His facial rejuvenation surgery obtained an outstanding result in contouring the neck as well as the jawline and lower face, partly through the premasseter space approach, aided with a submental approach for the midline platysma plication. The neck and the jawline can be restored to an attractive contour showing clean definition between the face and the neck. This technique is a new advance and has the ability to produce a natural looking result across the lower third of the face without any skin tension. It requires excellent surgical skills and certain expertise in anatomy, so currently it's only being performed by a few surgeons. It is called the premasseter lower facelift because it's performed through the natural premasseter space to the corner of the mouth and along the way firming the jowls, the jawline and the upper neck. Post-operative recovery is rapid, with minimal bruising and without obvious signs of surgery after about 2 weeks. The premasseter technique can be performed alone or as part of an overall facelift. The result is natural and it's subtle, and the result is lasting, in addition to which it also slows the appearance of further aging, a significant point. I hope this video has helped you understand aging of the lower face and its proper correction. Of course, if you need specific information, I encourage you to come and see either myself or one of my patient advisors for a complimentary consultation.